This is Shelley Kraft, and we're coming to you live on SNN Live. We're doing a Wall Street view at the Maryland Pavilion at International 2017 in San Diego with Dr. Christopher Austin, who's with the NIH, and we're going to be discussing the National Center for Advancing Translational Sciences. It's a mouthful, Doc.
It is. Thank you, Shelley, for having me on and talking to you about a little bit about what we do.
Well, what I want to drill in on is translational sciences.
Right.
That sounds like a concept that I've heard of, but I'm not exactly sure. It's probably not that difficult, but why don't you tell us about it?
It is a concept that you know about, everyone knows about intuitively. They just may not be familiar with the term. Translation refers very simply to the process of going from an idea, a scientific discovery, to a product that actually improves someone's health. Like all the people here at Bio, they're all trying to create products that improve someone's health. But those come from scientific ideas, which have a lot of potential, but there is a lot of work to figure out whether that potential is real and actually turn it into a marketed product. That whole process is translation. So we try to figure out how to do that better, faster, cheaper, and make all that information available to this entire community so that more treatments will get to more patients more quickly.
When I come to a bio,
Yeah.
the first thing that I think about is what's new.
Yeah.
Because it's going to come from a place like this because they want to integrate it, partner it.
Yeah.
So I also think about unmet needs,
Right.
because sometimes you can go to a conference thinking you're going to find something because you have a friend whose son has this.
Right.
And so how does that all get interpreted?
Right. So, well, I think the big secular trend that we're seeing is an era of massive collaboration in the biomedical sciences, particularly in translation. I think it's because both companies and the government and academia realizes this is a really hard problem, and there is a lot of great potential in science, but it's not getting to patients fast enough. So the way to fix that problem, in our view, is to have radically different kinds of collaborations. So I'll give you an example. We partnered with 3 scientists, 2 at NIH and 1 at a university, on a rare disorder called Niemann-Pick C disease. It's a rare, quite awful brain disease of children, no treatment. And there really weren't even ideas about how to treat these kids, and they all died by their early teens. We teamed with those academic investigators and patient foundations, parents of children with this disorder, and went from a standing start to a potential drug in 5 years, and then licensed that to a Maryland new company called Vitesse, which has now been bought by another Maryland company called Sucampo that's now in phase 3 trials. So we will have reached, we hope, in another year or so, the goal of this project, which was to have a drug available for these children in their lifetime, which without this kind of collaboration never, ever would have happened.
I would consider this great work.
Right.
What can you tell us about how you can increase your bandwidth?
Right.
Is really, it's what it comes down to.
Right. So the way we operate is we look at the big problems. What are the big roadblocks that are preventing this kind of thing from happening more frequently? Creating new ways to have them happen better, whether they're collaborative structures or collaborative agreements or division of labor in the science, and then codifying that, demonstrating in an individual case, like in this case with NPC, that it actually works, and then telling the whole world about it, teaching the whole world in a very active way how to do this, how they can do this too. Because there are 6,000 untreatable diseases out there.
How do you choose which one to...
Oh my gosh, it's heartbreaking because most of them are like the one I just described to you, untreatable diseases of children. But what's changed in the last 30 years is we now know what causes most of these disorders. We didn't know that when I was in training. We do now. And so we have starting points that we never had before. The problem is we can't operate the way we did 30 years ago when we didn't have that information. We owe it to patients to act differently and get the promise of science to patients who deserve it. And we're very excited about what we're seeing with this novel paradigm, which you see here. We work with at any one time, we work with about 200 collaborators all over the world on the order of 25 different companies to so-called de-risk these assets so that they can take them to completion of development.
So would you call, like, the NIH, it's almost like a receiving center for both demands for cures,
Yes.
treatments, and also for, you're like the central depository, as they say.
It's a good way to put it, and one of my favorite sayings in general, but it applies to this field of making treatments and cures, was said by a German bacteriologist in the last century, and he said that much is known, but unfortunately in different heads. So the way to solve that is to put those heads together. And when you can do that, and when you have a sort of Grand Central Station or a air traffic controller, that information comes in and goes out in a much more rapid way, and those connections get made, which are critical to scientific and therapeutic advances.
Now, interestingly enough, there could be duplicitous work being done. You could have, a hospital in
Right.
Russia that doesn't communicate with a hospital in Maryland.
Right.
And how do you get them to work together?
Boy, what a great question. We are applying these same principles globally. About a year ago, I took on the chairmanship of another difficult-to-pronounce group called the International Rare Disease Research Consortium. And this is a consortium of 40 funders, global funders from 40 different countries all over the world, about 20 different companies, multiple patient groups, scientists from all over the world do exactly what you're talking about. And we're creating what is essentially a massive spreadsheet of who's working on what, so that if there is duplication that's unintended, it can be eliminated, or they can begin to work together. And just as importantly, there are whole areas that no one works on, but we have no way of knowing what no one works on now because there's no central repository for that information. So that's what we're trying to solve.
How do you overcome this quote-unquote proprietary protection of my own development, especially when it could be tied in by an institution that's licensed it to a company that has commercial motivation, profit motivation?
Sure.
How do you get these guys to sit or not even sit, communicate and figure out how to cure a disease?
Yeah. Well, first
Is that your nightmare?
Well, first of all, I should say that the proprietary information and intellectual property is, as you know, is critical to a business being made around any or most potential therapeutics. And so we're eager to maintain that, or have the companies, whoever they are, maintain it, to maintain the incentive that they need to actually commercialize these. And what's interesting is, though one would think that this is a big roadblock, I can safely say that in the last 15 years, I can count on one hand the number of projects we have not done for this reason. It's almost always something that we can manage. And it comes down to assigning appropriate credit and appropriate incentives for contributions. And that could be single people, that could be teams, but patent law is actually pretty good at covering these circumstances. The larger issue is the cultural issue. You know, scientists are trained for good reason to be generally massively independent people. And they're not taught, at least I wasn't taught how to play on a team. Science was golf, as I was taught it, not football. And that's, one's a solitary sport, the other one's a team sport. Translation is a team sport. And so that's more the issue that we have. How do you change the culture? How do you change the norms where teamwork is the norm and everyone gets credit? The thing about doing projects like this is because they succeed more rapidly and to a greater degree, there is more credit to go around. And so we've never had a problem in that way because because there is a more rapid output and there is actually a success to celebrate and get credit for. A larger team can all get credit.
So let's assume that there's little or no, pressure on you to find unmet needs because there's plenty of those.
Yeah.
How do you accept, obviously you can be reached by email, by phone, et cetera. Somebody can send you a letter.
Sure.
So how do you know who to choose and who to take in and what criteria, how do you find your friends?
Yeah, it's one of the beauties of being at the National Institutes of Health. So NCATS, the center that I direct, is part of the NIH, and the NIH has a very robust peer review system where we put out solicitations for anybody who wants to apply. And there are clear criteria of what we're looking for. In this case, it's unmet medical need, a scientific opportunity. Right? So there's some medical needs that are really intense, but we don't have enough of a handle on it to be able to have an idea of what kind of drug would we make. So that's not a project we can do. So there needs to be a unmet medical need, a scientific opportunity, and then a team and a starting point for us to work with. And in that case, then they'll come in. We have peer review groups who review these applications and give us advice on which ones they think are most promising. Unfortunately, we can never take all the ones that are promising, but that's how they're selected. It's a very open process.
Why Maryland?
Oh, Maryland is the greatest place to do this kind of work. I'm a Maryland boy by birth. I was born in Baltimore, so I have allegiance to the state for that reason. But more importantly, for this purpose, there are hundreds of biotech companies in this space in Maryland. The biotech industry essentially started in the state of Maryland through Human Genome Sciences and Celera and companies like it.
And a couple of hospitals.
Yeah, there's a couple of hospitals, a couple of really amazing places called Johns Hopkins and the University of Maryland system and others who have absolutely top-rate first-rate basic and clinical research. And of course, there are all the federal research centers like the NIH, like the FDA, NIST. I was just visiting on Friday. They do fantastic work in the life sciences a lot of people aren't aware of. Even the Department of Energy does work in the life sciences, as does the USDA. So the raw material, if you will, in the state of Maryland is unmatched in my view.
What's your background?
I am a neurologist clinically, and I am a geneticist on the genetics person on the research side. I then spent a number of years, quite a number of years, in the pharmaceutical industry. I was at Merck for a number of years. I've also practiced medicine in community health settings and overseas, as well as in academic settings, and it's given me an appreciation of both the promise of science and the amazing things one can do in a laboratory to understand how human beings tick and when they go wrong, what goes wrong, but also what it requires to come up with a new treatment to fix it, which is quite a different problem. And then once you've developed a therapy, how do you get it to all the patients who need it? Even in parts of the country or parts of the world which may not have the infrastructure that we have here in Maryland or in San Diego. And all of that background is really I use every day in this wonderful job I now have.
So let's get your website out there for more information, if you would.
Yeah, so our website is easy. You can just Google us at the National Center for Advancing Translational Sciences, or we are at NCATS, NCATS.nih.gov.
Ladies and gentlemen, Dr. Christopher Austin, who's with the NIH, National Center for Advancing Translational Sciences, which we now have had a great explanation of what that is. And I'm Shelley Kraft. This is SNN Live. We're at the Maryland Pavilion at the Bio International 2017 right here in San Diego. Doc, I'd like to shake your hand.
Thank you. Thank you for having me.
You're